Is this safe back pain relief for seniors? Back pain is one of the most common health issues among seniors. As people age, natural wear and tear on the spine, along with conditions like arthritis or osteoporosis, can cause chronic discomfort. For older adults, finding safe and effective back pain relief is essential, but not all treatments are suitable for aging bodies. Age-specific or condition-based approaches are often necessary to ensure both safety and effectiveness. First, it's important to understand that seniors may be more sensitive to medications or more prone to side effects. Over-the-counter pain relievers like ibuprofen or naproxen, while effective for many, can cause stomach irritation, high blood pressure, or kidney issues in older adults. Acetaminophen is generally safer, but must still be used within recommended limits to avoid liver damage. Prescription medications, such as opioids, carry additional risks like dizziness, confusion, or addiction, making them a last resort. Because of these concerns, many doctors recommend non-drug treatments as a first step. Physical therapy is often a cornerstone of back pain management for seniors. A trained physical therapist can tailor exercises that strengthen core muscles, improve posture, and enhance flexibility, all of which help reduce pain and prevent further injury. Gentle stretching routines, aquatic therapy, or low-impact aerobic exercises like walking can also support back health safely. In addition to exercise, other non-invasive treatments may offer relief. Chiropractic care or massage therapy, when performed by professionals experienced in working with older adults, can help ease muscle tension and improve mobility. However, these treatments are not suitable for everyone, especially those with osteoporosis, spinal fractures, or other fragile bone conditions, so a doctor's guidance is essential. Hot and cold therapy is another safe option that can be used at home. A heating pad or warm bath can relax tight muscles, while a cold pack may reduce inflammation after activity. These simple techniques can provide temporary relief and are generally safe for seniors when used appropriately. Alternative therapies such as acupuncture or yoga have shown promise for some older adults dealing with back pain. Chair yoga and gentle forms of acupuncture are often adapted to meet seniors' needs and can be integrated into a broader pain management plan. Always consult a healthcare provider before beginning any new treatment. Perhaps most importantly, seniors should address underlying conditions contributing to back pain. For example, osteoporosis can be managed through diet, exercise, and medication, helping to prevent fractures that cause back problems. Maintaining a healthy weight, quitting smoking, and staying active can also make a significant difference in spinal health. In summary, back pain relief for seniors must be age-appropriate and consider individual health conditions. Non-drug approaches like, subscribe, follow for your free back pain relief ebook.